Patient information leaflet, growing pains in children. Growing pain is also known as benign idiopathic nocturnal limb pains in childhood. Growing pain is a pain which is commonly seen in children in the age group of 3 years to 12 years. And this is a common cause of worry not only in the children's but among the parents also. As the name suggests, it is not related. The cause of this growing pain is not known, and which is contrary to the name which says growing pain. So we do not have any cause for the growing pain basically. So what actually are these growing pains? So these are the pains which are like occur recurrently in these children and are usually found to be at the end of the day, in the evening and the night hours of these children. And they are normally confined to the lower limbs, in the legs, and it will mostly involve the calves, the shins, around the ankles, and in the front of the thighs. And they usually do not involve the joints. Basically, with regards to the cause, we do not have any cause which is attributed to the growing pains. Some of these children are found to have a decreased level of vitamin D, although many of these children will have a normal level of vitamin D. So in these kids, we can supplement vitamin D if it is needed, basically. And one thing reassuring about these things, this growing pain, is that they are not serious and do not lead any harm to the children. And normally, who are the children who are more prone to get these growing pains? The children of the age group of 3 to 12 years, and those children who have a flat foot, and some children who have a hypermobile joints, they are found to be more prone to this growing pains. And what about the, like, how does it feels? Normally, it is in the evening hours, and it is a aching or throbbing pain in the legs. And for the diagnosis of this growing pain, it doesn't need any investigation per se, although your doctor might advise you some blood tests and X-ray of the affected points to rule out other things. But the diagnosis of growing pain per se does not require any of these blood tests or X-rays. So how to get relief of this growing pain? So first thing is reassurance of the parents along with the child. They have to be told that this growing pain is not a harmful thing, and normally it takes some months, a few months to resolve. It will go by its own. The legs can be massaged in the affected area. Heat pads can be applied that way. And if the pain is too much, we can use paracetamol or ibuprofen. And they are ideally advised to maintain a diary of their pain symptoms. So if they are maintaining a diary, they know which all activities or which time of the day they are having this pain, because this pain normally occurs in active children also. And those children who have had a tiring day. So in those cases, if they know the diary, it has been noted in the diary, so before they are going for those particular activities, they can be given some prophylactic paracetamol before the strenuous activities, which will help in preventing them. So there are some red flag signs which are important to be understood in the case of growing pains. And if these red flag signs are there, then it is less likely to be a growing pain. So as I said, growing pains are usually confined in the lower limbs. So if the pain is in the upper limb, it is a red flag sign. Or if it is involving the spine, if the child is unable to walk, he is limping due to this pain, or he is unable to take part in his sports activities. So that is something abnormal which should be taken care of. If there is any signs of inflammation in the joint, like redness of the joint, swelling along with pain, loss of function. So this is something which is not normal. And like if there is any rash or bruising in any part of the joints along with it, that is also something like abnormal. And normally these growing pains are seen in both the legs. So if it is confined to one of the legs, it is an alarming sign, and it should be taken care of. And normally pain which is there in the morning hours, so this is also something alarming, because growing pains are usually at the end of the day, towards the evening and the night hours. And a pain which is very serious, and if there is loss of weight or loss of appetite, So we have to think of something abnormal, and we need to contact our doctors. So in summary, this is for growing pains.